Hello, hello, hello. All right, so we're going to talk about endometriosis, right? We're talking about endometriosis with infertility. What is endometriosis? Well, let's look at our handy-dandy uterus over here. Endometriosis, if you will, is the presence of the tissue that's supposed to shed when you have a menstrual cycle. It sheds, comes out. Well, imagine that tissue dipping into the muscle of the uterus, and you have this black dot here, spilling out the fallopian tubes, and you have, black dots on the outside over here, or heaven forbid, located in the ovary where it has nowhere to shed to and shed into itself, and it forms what is called a fallopian chocolate cyst. Some people, there's another form of it where it does penetrate the muscle. We talked about that. And some people believe it could be when the endometrial layer sort of invaginates and dips into the muscle itself and it affects it, and that's not really good. Or there's another theory, it could occur de novo in some of these places. So whether it happens there by retrograde menstruation, invagination, or de novo, the end result is the same. The problem is, if you will, think about this. This is material that's supposed to shed out of your system, right? When you have a menstrual cycle. But if it sheds the other way around, it actually provokes inflammation. It causes a hormonal imbalance. It affects egg quality, affects implantation, and even can cause problems in the fallopian tube. The inflammation that's caused can block the tube. Not everyone with endometriosis will have infertility, however, which is unfortunate. I'm sorry, not everyone with endometriosis will have infertility, which is fortunate. But sometimes it can cause devastating infertility, and it's very heartbreaking. And it needs to be recognized and appropriately treated. Sometimes the treatment is laparoscopic. If you have it trapped in the ovary, it sort of bleeds into itself. It's not going to go away by itself. If it forms a large chocolate cyst, that may need to be removed. The difficulty is when it invades into the uterus. That's called adenomyosis. That may not always be resectable. That you may not be able to take it out. But in spite of that, people do get pregnant with endometriosis. So if you suspect a diagnosis of it, have intractable pain around your menstrual cycles, get it evaluated, get it looked into to see if you need to be treated right away. Since it can affect your eggs, you might even want to consider freezing some of your eggs early on in the diagnosis before it impacts the egg quality and quantity. All right, so send me more questions. I'll be able to tackle them. I hope that answered some of your questions. Thank you.